Welcome to the Gary Null Show, a program designed to enhance mental, physical, and spiritual well-being through science and the wisdom of the ages. Let us take you on a journey of empowerment. Sit back, relax, and get ready to change your life for good.
Hi everyone, I'm Gary Null. Diabetes is at an epidemic level, and it's preventable in most cases. How many people suffer from diabetes? The best guesstimates are between 20 to about 27 million Americans. Now what about all the people who are pre-diabetic, all the people who are overweight and have high blood pressure and heart disease, but are not officially diagnosed, maybe even haven't had their blood sugar checked? What about all the children? For the first time in American history, we have a high percentage of children who have adult type 2 diabetes. We're also seeing those same children who are overweight, have high blood pressure, heart disease, even arthritis. In fact, it has been estimated that many of the children today will actually die of these diseases before their own parents. We haven't seen that in the past. What is diabetes? We're going to explore this with one of the finest panels of experts on diabetes. And what these physicians and healthcare providers have in common is they believe that we can prevent most diabetes, and if we have the condition, there are natural and non-toxic methods that can be used along with any orthodox method. Join us now for this special presentation on preventing and reversing diabetes naturally. Dr. David Edelson is Assistant Clinical Professor of Medicine at Albert Einstein School of Medicine. He is also board certified in internal medicine. Nice to have you with us.
Thank you, Gary.
A lot of people, they don't even know what diabetes really is. They only know that it's dangerous and somehow they're taking like insulin or medicine to control it. What do we do that actually makes us go from non-diabetic to pre-diabetic to diabetic?
When we talk about diabetes, first we have to distinguish between two different types of diabetes. There's type 1 diabetes, which is also known as juvenile diabetes. That's not for the discussion here. That's a disease where the pancreas basically stops functioning due to immune problems, where the pancreas basically is destroyed and stops making insulin. When that happens, the patient needs to be on insulin therapy to survive. What we're talking about is adult diabetes or type 2 diabetes. Now, type 2 diabetes is actually a disease where there is too much insulin in many cases. I like to look at it as not just a single entity, but really like a timeline. Starting off from the point where you have just the genetic predisposition towards developing this disease, but none of the symptoms or signs. And then we take and add in the environmental problems, poor lifestyle, sedentary activity, poor diet with lots of high glycemic carbohydrates and inflammatory types of trans fats. And then we see the first stages of what we call insulin resistance. From there, we start to see the glucose levels begin to climb and the hemoglobin A1Cs or fructosamine levels begin to climb up out of the normal range. Now we are developing the next step, which is into metabolic syndrome. Now, this is a constellation of symptoms which traditionally we now describe as 3 out of 5 of several factors. One would be elevated blood pressure. Secondly would be a low HDL level. Third, a high triglyceride. Fourth, high fasting blood sugar above 100. And fifth would be abdominal obesity. From here, continued problems with lifestyle and poor diet and environment, and we begin to move further where the sugars now become actually out of control. And eventually we reach the point at what we call the patient fully diabetic. But once we've reached this point, it doesn't mean that we can't move people along this line, and that's the key factor. Push them back to the beginning where they don't have to take medications and they don't have to suffer from the complications that are so prevalent with diabetes. In order to understand my approach to the treatment of diabetes, You have to kind of look back at my own personal journey, because I come from a very traditional background. I went straight from high school into a 6-year medical program at Northwestern University. From there to a traditional internship in internal medicine. Then I was chief resident, and then from there I went to a fellowship in diabetes research, Hadassah in Israel, and finally back to New York to start a practice. And I hung out my shingle, and I started seeing patients in a primary care setting. And I found myself day after day seeing patients with chronic illnesses, heart disease, hypertension, obesity, diabetes. And as I went through the first years of my practice, I found myself feeling more like a fireman than a doctor, putting out fires all day long and throwing medications at people and trying to move people through the office as quickly as possible. And finally, after about 10 years of this, I found myself feeling very unsatisfied with what I was doing. Here, I believed in a healthy lifestyle. I tried to eat as healthy as I could. I tried to exercise. I ran marathons. I did triathlons. But I couldn't convey this to my patients. I figured I'd go back to square one, and I went back and I joined a group called the American Board of Bariatric Medicine. I became board certified in weight loss and bariatrics, and I saw my first patient, and a woman came in with her daughter who was probably about 240 pounds and 5'4", already had developed diabetes at the age of 16. She plopped down in the chair in front of me and started eating a bag of Twizzlers. And the mother looked at me and said, "I need you to help my daughter." And I suddenly realized I was completely unprepared for this, that I didn't have the tools as a single primary care doctor to help. And that's when I made the decision that I needed to look to a better way. And I developed a plan to build what we call an integrative medical facility, where we brought together healing practitioners from many walks of life, nutritionists, psychologists, even exercise and fitness trainers. We even built a gym in the facility so people could actually exercise under supervision. We brought in physical therapists and chiropractors to help with the injured. We built a sleep medicine facility because so many of these overweight people had developed sleeping disorders. And we developed this model of what I call the puzzle theory, that it is not just a single problem that ever makes somebody become overweight, that it's usually a constellation of many different pieces. When little things begin to go wrong, they begin to kind of get all tangled up together, and eventually you develop the condition, and in this case, obesity and diabetes together. So with this puzzle model, what we try to do is we try to break everybody apart, and each individual area gets evaluated. The nutritionist looks at their diet. The exercise people look at their fitness. The physical medicine team looks at their injuries. We do an extensive blood testing, including full lipid profiles and insulin levels and C-reactive proteins and hormonal profiling with thyroid imbalances. Even menopausal hormones, as many women after menopause will gain weight. Growth hormones, leptin levels, all these things to try to develop a better understanding of what was going on at the core of these people's problems. And now we begin to see where the problems are, and when we can take each individual puzzle piece and begin to mold it back into shape and put it back together into the whole, we found that people were getting amazingly good results. Once you understand where your problems lie, it's amazing how great people can do and how many people that we've been able to not just reverse diabetes and get them off of medications. One of the problems is actually some of the diabetes medicines actually cause weight gain, which then causes more insulin resistance.
We have now an epidemic of the use of insulin in type 2 diabetics. You're heavy, your blood sugar level is elevated, the doc wants to bring down the blood sugar level, so he gives you the pills. That doesn't work, and then he starts low doses of insulin. Insulin always causes weight gain. This is nationwide. That diabetologists and endocrinologists and internists will use insulin in a type 2 diabetic who's already heavy, and they gain weight. So we will always gradually, if not immediately, stop that insulin in the type 2 diabetic and put them on exercise, put them on a high-fiber diet, put them on nutrients, do everything we can to get that weight off. And you can't get that weight off if the individual happens to be taking insulin. Insulin is very important for type 1, but only 10% of diabetics are type 1. 90% or higher are type 2, for which insulin should never, in my opinion, ever be used unless the individual reaches normal weight. And if the individual reaches normal weight and still needs insulin, I don't think he's type 2. He's more than likely type 1.
Insulin shots in a type 2 diabetic can often be a disaster. That doesn't mean there aren't cases where it's necessary, but I would say 90% of the time when I see a patient either on insulin or drugs that we call sulfonylureas, which actually raise insulin levels, the body begins to store more fat around the midsection, and fat makes them resistant to insulin, and the more resistant means higher insulin levels and requirements, and this becomes a vicious cycle. And these vicious cycles often result in the worst outcomes. By cutting the cycle, removing the offending agent, and reversing the underlying cause with natural therapies, we've been able to see tremendous results of getting people not only off of their medications, but in many cases actually reversing the disease process itself. And this is the wave of the future for medicine. Not sick care, but real health care.
Now let's speak with Dr. Jill Barron. She's board certified in family practice and in holistic medicine. Nice to have you with us.
Thank you very much, Gary.
How do you know that someone is pre-diabetic? Also, we know that inflammatory conditions are among the leading killers in the world today. Talk about inflammation.
So pre-diabetes is a condition where the fasting blood glucose is between 100 and 125. Diabetes has a fasting blood sugar of 126 or more, and having a normal blood sugar would be having a blood sugar less than 100. Now, the scary thing about prediabetes is that many patients, and most patients, don't know they have it. And prediabetes is usually seen in people who tend to be overweight and have what's called visceral or abdominal obesity. And when I see my patients, all my patients get many blood tests. So there are 3 blood tests that can be indicative of prediabetes. One is the fasting blood sugar, where the blood sugar is between 100 and 125. The second test is called fructosamine, and that is a blood test that averages a person's blood sugar over 2 to 3 weeks. And if that's elevated, that could also be indicative of diabetes or prediabetes. The third test is called a hemoglobin A1C, which measures a patient's blood sugar over 3 months. And if it's over 6, then that person can be at risk for prediabetes or diabetes. We've all heard a lot about inflammation. Inflammation is actually a protective mechanism in the body. We need to have inflammation when we fight infection. Because of different stressors in people's lives, the body can become inflamed. How does a person know that he or she has inflammation? Well, if a person's overweight, you can be sure that a person has inflammation. But we can also look at blood tests, specifically what's called the C-reactive protein and also the cardiac C-reactive protein. And these are proteins that are measures of inflammation. In fact, I measure a cardiac C-reactive protein in all of my patients. So the cardiac C-reactive protein measures the inflammation in the heart vessels. How can we prevent inflammation, and how can we treat inflammation? Well, it's very important to have what I would call an anti-inflammatory lifestyle. And what that means is to keep one's stress level low. It's very important to have a plant-based diet, or you can have organic and wild fish. It's also important to have a diet that is rich in whole grains and what are called legumes like beans and peas and nuts and seeds. It's also important to have certain supplements like omega-3 fatty acids. The best form is in fish oil because fish oil contains 2 major components, what's called DHA and EPA. The only form you could get the combination of both DHA and EPA is from fatty fish. Now, it's recommended that you can get 2 servings of fatty fish a week, but if you don't get enough fish in your diet and you also have a high level of inflammation, it may be wise to take fish oil supplements. And I want to add another one called vitamin D. It's important to have your vitamin D levels checked, and it's specifically 25-hydroxy vitamin D. And it's important to have a level probably between 50 and 80 in the blood because vitamin D deficiency has been associated with inflammation and cancer and multiple sclerosis and other diseases and depression and heart disease. I would also add exercise and having an ideal body weight as being anti-inflammatory. Preventing diabetes actually would seem to be quite simple if humans were not human, because it's very human to want to overeat, to like sugar, to eat foods that aren't always the best for us. And it takes real discipline to eat healthfully.
Thank you very much. Now we're going to talk with Luann Panesi. She's part of a growing phenomena. This growing phenomena is called holistic nursing, and there are thousands of nurses now in the United States looking at what they can use in the orthodox sense, but then going beyond that. Tell us about what you look for when you sit with a patient.
So I'm a holistic nurse. What it means is that we look at every facet of the person's lifestyle and we explore what could be creating the imbalance. What I love about my work is that I could have 3 or 4 people come in with diabetes and have 4 different approaches with them, because we need to look at the root cause. We don't just look at covering up symptoms or helping them learn about the side effects of drugs. We look at what created the imbalance. So when we have someone with diabetes, we have to look at, is it something that's constitutional? Might there be a genetic component? Next, we have to look at, obviously, their physiology. Most people are very dehydrated. They're not getting enough fluids. So we ensure that people are hydrated. But what are they drinking? We don't want people drinking coffee or alcohol. We want them drinking healthy fluids, things like filtered water or green tea, which is loaded with antioxidants. We look at their general diet. We've been conditioned to eat foods that are not good for us. So we think that if everyone's drinking soda, it must be okay. If they're serving us pizza in public schools, it's okay. And most of us don't step back and say, is there something here that could be creating an illness in me? No, we just want to eat so that we're not hungry anymore. The problem is that the standard American diet is, in my opinion, as a registered professional nurse, it's killing our children, it's killing the general public. So now we're hungry, it's lunchtime, what do we have? I help people to understand that there are healthy foods like beans and grains, squash, sweet potatoes, yams, all the green leafy vegetables. I also encourage people to have green vegetable juices. Now, to most people, this sounds foreign. It sounds like, uh-oh, I'm going to mow my lawn and drink it. You can make green juices taste absolutely delicious. You're oxygenating the body, and that's what our metabolism needs. It alkalizes the body, and I encourage people to have some acid foods. Proteins are amino acids. They're low acid. But what we want to stay away from are the hyperacid foods, like too much meat and dairy and sugar and processed foods and caffeine. All of these things acidify the body, and that creates more inflammation. And diabetes is about inflammation a lot of the time. Next, we look at, are they moving their body? Most of us are sedentary. Part of my work with people is integrating a healthy exercise regimen, and that's going to be very individual. It's going to be different for each person. So if someone's coming into me and they're 200 pounds overweight, which I see a lot of people, unfortunately, their exercise is going to be different from someone who's maybe 20 pounds overweight. And also managing stress is important. I encourage people to take quiet time every day for 30 minutes and listen to some beautiful music or to do some kind of meditation or relaxation. It makes a huge difference in your health and your well-being. I have found that when I give people the right tools, the practical ways to integrate a healthy lifestyle, hook them up with the right practitioners, they get amazing results.
Dr. Chris Callipy is here to share his insights. Dr. Callipy is board certified in anti-aging medicine, and he believes in a more complementary natural approach. Nice to have you with us, Chris.
Thank you, Gary. I wanted to comment on a few different things relative to diabetes. Most people don't understand what it's about and don't understand how it needs to be comprehensively treated. And one of the basic comments when I discuss this with patients, and whether a person's pre-diabetic or a child is overweight, or this progression is occurring where their sugar starts to climb, cholesterol, triglycerides, LDL, weight, and blood pressure start to rise afterwards, we, of course, take a person's history, want to see what they're eating, what their food pattern's been. Typically, we see that their carb intake as a child is overwhelming. As the blood sugar elevates, that can start to damage the lining of the blood vessel, and as the blood sugars increase, we start to see insulin released to try to keep the blood sugar in an appropriate range. But unfortunately, as with every meal and 3 or more times a day, and every day and week and month and even year, we see huge carbohydrate intake, 300 or more grams or so per day, we start to see overproduction of insulin. And the overproduction of insulin starts to knock down the blood sugar, and that tends to make people crave. This is a crucial point. Hypoglycemia makes a person want to eat carb. And the excess carbs that people take in, whether from fast food, junk food, candy bars, it just forces the sugar up. You start to dump more and more insulin. That blood sugar will drop, and you will crave. You will eat the carb. When we talk about the comprehensive testing that we do, of course, we look at blood sugar, we look at chemistry, CBC, but the most important blood test that I tell patients they need to do is a blood test for vitamins and minerals. Your nutrients protect every single cell and tissue of your body. Many, many people are walking around with vitamin and mineral deficiency and setting the stage for diabetes, heart disease, cancer, and virtually every horrible disease that we deal with. We will always look at hormone levels, because as your thyroid level declines, even in a young person in their 20s, you can see thyroid decline. That can make it harder for your body to burn sugar, burn cholesterol and fat. And we can talk about heavy metals as well. Research shows that mercury is a common heavy metal that can cause autoimmune thyroid disease. So the metals, as they can damage your thyroid hormone production, sure as anything can cause damage to your insulin production. We'll look at testosterone levels in men and women. Testosterone is an important hormone for many reasons, but it's also good to help to burn fat and sugar, especially as you do exercise. If DHEA is low, it's an adrenal hormone that makes it harder to burn sugar and burn fat. If a person has a low growth hormone level, that's a mother hormone that helps to make the cells that will produce the DHEA and the cells that produce thyroid hormone and testosterone. I've got a terrific case of a patient who was 75, was a longshoreman, very big, strong, stocky guy. He came in, he was diabetic for 30 years, and his cholesterol was high for many, many years, probably the same amount of time. High blood pressure, at least 50 pounds overweight. And I sat down with him. As I started to put together the plan for him and explained it to a T, he was able to understand it in very basic terms. And we did the blood work. I put him on low carbs. He was testing his sugars. And I had him come back in a week. He started bringing his sugar down, started to lose weight. Over the course of about a month, he was non-diabetic. After 30 years of being diabetic, he was non-diabetic because his numbers were down in a perfect range off his medication. By the 3rd month, he lost 55 pounds. We took him where he was racing into cardiovascular disease and a whole host of other issues, and we brought him back to where he was in a normal state. And he feels, like a completely new man. When we talk about nutrients that we have to use, I talk about core vitamins, like all of the Bs, the vitamin C. Vitamin C is wonderful, and intravenous vitamin C can reverse the damage on the lining of the blood vessels from diabetics and from smokers. Magnesium, potassium, all the minerals. These are things your body has absolute requirement for. Of course, chromium is ideal for diabetics because chromium helps to stabilize blood sugar, may even make insulin do a better job at controlling the blood sugar. Vanadyl sulfate may have the same effect. So as we put the vitamins and minerals in place, as we get the hormones in the right range, as we get them to walk a little bit every day, we're not asking them to run marathons at all. Start out and do a little bit of activity. If you have problems with your legs, get on an exercise bike and do a little bit of activity there and progress. 5 minutes more every week or so. And after a while, as a patient is able to do more of this, the results become much more dramatic.
Now we're going to hear from Dr. Sabina Gruchowski. Not only is she an internist, but she's also has a background in anti-aging medicine. Nice to have you with us.
Thank you, Gary. As an internist who I think has made the transition from traditional internal medicine to anti-aging, functional, and regenerative medicine, I realize more and more that prevention is the key to everything, and I don't think we're doing such a fantastic job of it. As someone once said, if in the beginning stages, a disease is very difficult to recognize and very easy to treat. In the end stages, it's pretty easy to recognize and very difficult to treat. We have little that we can offer patients. So starting with that premise, diabetes is a continuum. It's not one disease. It's a continuum that includes hypertension, that includes hyperlipidemia, decreased HDL, increased triglycerides, and of course abdominal obesity. And we cannot take type 2 diabetes and take it out of context. I have very few patients that I know who are thin type 2 diabetics. So I think we have to expand the way that we look, the way that we try to diagnose the disease, and the way that we try to prevent it. And if we don't look for something, we're never going to find it. Therefore, in anybody, I usually start by looking for any evidence of leaky gut syndrome. Leaky gut syndrome is extremely important because in this modern day and age, everyone is inundated with toxins. We're all poisoned with heavy metals, herbicides, pesticides, fried foods, stress levels, lack of sleep, adrenal fatigue, which all leads to leaky gut syndrome and dysbiosis. And as we know, 80% of our immunity is in the gut. So that's one of the first things that I would test for. The second thing is, of course, we look for thyroid issues. We look to see if someone is hypothyroid, but there's also type 2 hypothyroidism, which means that the receptors are blocked and you can have blood tests that are completely normal. And this stems from lack of nutrients, from lack of microelements. We look for hormone issues, male and female hormones, which are extremely important. We address the issues of adrenal fatigue, increased cortisol. Then we look for nutrient deficiencies. However, we can bombard the patient with all the nutrients in the world, but if we haven't fixed their leaky gut, we haven't addressed the issue of intestinal dysbiosis, candidiasis, lack of good bacteria, then we're never going to get anywhere as far as treating the patients with all the micronutrients in the world. It's good medicine, it's good prevention, and I think that's the way we have to start looking at patients, and that's the way we have to start treating patients and try to get away from our so-called standard of care.
Excellent information. Thank you very much. Just imagine how many different approaches there are to any condition. So this idea that in American medicine, the average physician should be looking at a single cause, a single type of treatment, that's archaic. You're seeing the integration of multiple concepts into one patient.